All right, welcome everybody. It is your favorite time of year, time for all of the paperwork that we have to do here in FORP to get more funding for next year. So we're going to talk through the NCC process, the non-competing continuation progress report for fiscal year 26. Next slide, please, Yara. I'm going to try and talk fast so that we have time for questions at the end because I am wondering if I think we will have a lot of questions. So we're about to start year 3 of your 5-year project period, starting September 1st of 2026. The tasks are already open in EHB. The guidance was attached to that right there. It opened up on March 2nd. And I will say for anyone who may have asked about this before, we did extend the deadline for this NCC submission by a week. So it is now, instead of being due on May 1st, it's due May 8th. And we did that because I know everyone's waiting for the SOAR NOFO to drop, and it's projected to open soon. I do not, if you're going to ask, I don't have any more information on that date. I think everyone wants to know the same as you do, but we wanted to make sure that there was a little bit of buffer time in there. So we have extended the deadline for you all, but we did that at the expense of our own internal review time. There's certain things that I can't push back to get all of the funding memos in place to get everything ready to go. So I'm going to ask you all for a favor. Because we have a shorter review time on the FORP end, I'm going to ask you to please, if you have questions, concerns, you're not sure about how to fill something out, reach out to your PO early with questions as many times as you need. We would rather answer the questions ahead of time. That way, we want to avoid having to send submissions back for any revisions later. And I know, I'm not trying to call anybody out, but I know on SHIP there were a lot of things that had to get sent back for revisions. So we want to try to avoid that with Flex, since we have a shorter review time. So please reach out with questions along the way. Next slide. Yes, and since I forgot to mention this, thank you, Krista, for putting this in the chat in case anyone hasn't seen it. Please drop any questions you have in the chat. We'll save them all for the end, or Krista will answer them along the way. And then once we get done with all of this, we can have just a full question and answer session in case anyone needs to ask anything. So the purpose of your progress report, for all of the folks who have been here before, you already know this well. If you're brand new, this NCC progress report is basically how you tell us what you've done over the last year, how it went, and what your plan is for next year, to show us that you've made enough progress to ask for next year's funding. So like this says, this is your project plan for your continuation of funds. And this is your chance to update, readjust, and make to refine anything you might need to on your Flex projects. This is not the time to make huge, substantial changes to your projects, but we can talk about that later. Next slide. So I have this slide here with some helpful tips, and I ask this of everyone every single year. So you can always, we'll send these slides out and you can come back to look at this. Submissions will be returned. If we're missing information, if they don't have enough information, we will send them back to you and ask for revisions. On your attachments, please make sure to include the grant number, your project title, your organization name, and who you as the primary contact are. And please save those in either a PDF, a docx, or an Excel file. Please do not scan those documents as images. There are times that we need to go in and highlight certain things, copy and paste numbers or things like that. So please don't save them as images. And please only attach the documents that are listed in the instructions. My other final ask, I want to make sure, if you can, every file name that you have for your attachments, please put your state postal abbreviation in the beginning of it. At a certain point, we'll all start downloading everything, and I can't have 45 budget justification FY26. I need to know which state it belongs to. And it is really helpful. This is just my tip. If you can get an editor, get a fresh set of eyes, somebody who maybe doesn't know your program very well, to make sure everything makes sense. That is always a helpful tip, no matter what kind of a report you're writing. Next slide. Okay, performance narrative. So this is really where you're telling us how things went last year or this year, right? How they're going. So no more than 10 pages, please. It can be single or double spaced, and make it in a narrative form. We don't want to see a copy and paste of your work plan. We're going to ask for that in a second. Really what this is summarizing your work plan, summarizing the work that you did and are doing and the progress that you're making, right? So this is only intended to report on your Flex program work. Please don't report on any other HRSA funded programs unless it is specifically tied to your Flex work. Next slide. So we want to, again, hear progress on your activities and on your projects, right? A high level summary telling us how things have gone so far. Let us know any barriers or challenges that you've had to your progress during this current budget period and what efforts you're taking to address them. Um, and again, please include information on the progress towards your outcomes. You all, during your competitive application back in fiscal year 24, had to choose outcomes there. We know it is very possible that you need to change those outcomes, change your projects, everything like that. This is where you can tell us what's happened, how you've changed it, why you had to change it, and making sure that you're going to have that data to report to us at the end of the year. Next slide. If there have been any significant changes to your flex program during this reporting period, let us know. And when I say significant changes, that means a change in scope for your work plan, a significant budget remove or budget change, key personnel changes like a new project director. You can let us know here in the narrative. I want to repeat, this is for telling us what has already happened. This is not to ask to do this during your NCC. And then there's a section for your narrative to tell us about your plan for the upcoming year. And, starting September 1st, oh, those dates are wrong. That should say 9/1/26. Sorry, that's my bad. I'll fix that before we send these slides out. Give us an update on how things have been going, but then tell us how you're going to continue that work next year. Does that mean you need any current modifications to move forward? And are you going to be anticipating any changes in scope or changes in budget next year? Next slide. I'm going to make 2 asks of you all in your performance narrative. And again, we will include these slides to everyone so you can come back and reference this. If you have not been able to fill out that part of your work plan for facility outcomes, right? That hospital level data telling us how your projects have been going. We understand projects take a while to get moving. You maybe have to change some projects. Maybe the reporting timeline is off from our reporting timeline. If you have not been able to collect that information yet, please tell us how you're going to ensure that you will have that information in the future. That is going to come key in the next couple slides when I tell you some more information, but please make sure that you tell us how you're going to, your contractors or you or whoever is going to be able to share that information with you. And then this is for our own information. If you can make a note to tell us whether or not you and your office are coordinating with your rural health transformation plan. We know some offices, maybe you are the office that has that information. If you're not, we would love to know if you're coordinating with them. If you are, can you tell us how? And if you are not, you can mention that too. We know that that is not happening for everyone. This is not meant to get anyone in trouble. This is genuinely just meant for us to get a pulse on who's doing what, right? Next slide. Okay, just a quick reminder. Any of the activities and projects have to fit within the core program areas of the Flex program, which I have listed down here. Quality improvement and financial and operational improvement are required. Population health and EMS are optional, and CA designation is required if requested. If you have any questions about what are some common projects I can work on, what are the common outcomes associated with those projects, click on that Flex structure document that's in on the task website, or we can send it to you if you need to, and you can get a bunch of information and examples in there. So again, significant changes in your work plan need to go through a prior approval in EHB, and your project officer can help you do that. Next slide. Okay, so we're going to talk through the attachments really quick. This is just the list of what attachments we need. We're going to go through each one in a second. Next slide. Okay, this is a big update for everybody. So you noticed on there, attachments 1 and 2 are about your work plan. And I know everybody's going to be so excited when I tell you what's about to come. It's the moment you've all been waiting for, talking about your work plans. Next slide. We finally have approval, finally, from the Office of Management and Budget to launch our brand new data system in Salesforce. Yay. Oh my gosh, people are actually celebrating this. Oh, I'm so excited. I thought everyone was going to be mad at me. Okay, next slide. So I know everybody's probably thinking, on top of a SOAR application and a Flex NCC, you're throwing a new data system at us. Laura, what are you doing? I know this is a lot. I promise we've made this as easy as humanly possible. And the way that we set this up, I'm just going to kind of explain things very briefly here. And we're going to have a webinar next week to go through many more details on this whole system. I'm just waiting for the developers to give me a day and time that we can do that. So the work plan, the data collection platform, DCP, is designed to mimic a work plan. So the current work plan template that kind of, it looks in Excel, it goes left to right across the tabs, right? And you tell us your project, who's responsible, what you expect to happen, your outcomes, et cetera. All that same content will be the same, right? It's just going to look a little bit different. Instead of left to right, it's going to be top to bottom, and it's going to be text fields that you can fill in with that same information. So we've set it up where you can go in, you'll fill in about half of the information for your work plan, your update for this year, and your plan for next year. The work plans will be submitted during the NCC. The end of year report, instead of PIMS with the check boxes and a separate narrative and a separate work plan update, that end of year annual report will just be updating this work plan in DCP with that facility level outcomes, and we can pull all the data that we need to show improvement at that point. So I see Scott's question in the chat about entries due, DCP entries due May 8th. I'm going to come to that on the next slide, or maybe the second slide. Go to the next slide, please. So what is important to check on things right now? I have more information, Scott, on your question in the next slide. I couldn't remember which order I put them in. So I'm going to ask you a couple of things just for this week to check on things. One, please make sure when you're doing your work plan update, you are updating the correct version of your work plan. We had every single state that had to make changes last year in their work plan for obvious reasons, we know. And then what ended up happening at the end of your report and sometimes on SHIP is I think folks forgot and went back to the old version. So I'm going to ask you to please make sure you're looking at the correct version of your work plan. If you already have a login for DCP, meaning you accessed the PIMS reports before when they were in the system, or you think you might already have one, if you've asked for one, you can click on that link, make sure it works, okay? We are going to ask you to please make sure that more than one person has access to DCP. That way, someone else can hit submit, someone else can hit the button. If you don't know who else in your office has it, reach out to us. We can kind of help figure that out, or let us know who should have access and we can get moving on it. If you have someone who needs access in your office, that user needs to already have EHB login.gov XMS credentials, okay? And then you need to email your PO, give us their information and their email address. We will send that over to our IT folks to get that ticket open so we can get them access, but that will take 3 to 5 business days. So please do not wait until May 7th to ask us for access to DCP. Next slide. Okay. This is just, I'm just going to say this here so that nobody panics when anything happens, but there is a new HHS cybersecurity policy. It's going to become standard practice that any accounts who have not logged into DCP for 60 days will be, quote, deactivated. And I am using that term deactivated very loosely. That's going to start on March 26th. You're going to get an email 7 days before telling you that your account will be deactivated in X number of days if you haven't logged in. If you log back in as normal, nothing will deactivate. It will be perfectly fine. If you miss that window and the system deactivates your account, don't panic. I have been assured that if you log back in as usual, it will automatically be reactivated. If for some reason it doesn't, please email me and your project officer, and we will talk to the IT folks and fix it. This is why I say I use the term deactivated very loosely, okay? Just wanted to put that out there so nobody got surprised if an email comes through that says we're going to deactivate your account. It's completely fine. You can just log back in. Next slide. Okay, so to Scott's question, what does this mean for my work plan attachments that have to get uploaded into EHB? So because EHB is the official grant folder, a work plan must be present in EHBs. We are trying to find a way to get DCP and EHB to talk to each other. We're working on it. But until then, what needs to happen is when you put the work plan in the DCP system, there'll be an option to export, and you can export it into a PDF, an Excel, whatever you just choose to do, and do that. And then you just need to upload those documents into EHBs. I want to stress, I am not asking you to fill out the old work plan template on its own and put that in EHB at the same time as going into DCP and putting that same information in. I'm not asking you to do that. You can just export what's in DCP, okay? Just a quick reminder for these documents as you're working on this, you do need at least one project with one outcome per program area, same as the previous years. And if you are including a new project that you're proposing, You will also need to have an outcome measure that you are hoping to collect from that. So yes, to answer your question, Scott, the DCP entries will be due May 8th, but I spoke to somebody about this morning. I'm going to put a little caveat on that, that DCP entries are due May 8th, but if you need to run your EHB entries up the chain to whoever for approvals before the submit button gets hit, then I really, really recommend that you put everything into DCP before that, so you can include that information in the EHB uploads. Okay. Next slide. All right. So like I just said, we're not using this work plan template, but this is the only visual I have right now to show you what I'm talking about when I say, if you have a new project, you need an outcome measure. So where that star is down here that says quality improvement project, we need to know what your outcome measures are that you're hoping to collect. This does not mean that you can't change it in the future, that you must collect this information. It's perfectly okay to say, I hope to collect this now, but in 6 months, I know this project is going to change. That's perfectly fine. But this is just the part of me showing you what we need to have in the system. Next slide. I put this in here last year, and I'm going to put this in here again, just as a quick reminder for everyone to come back and reference the difference between outputs and outcomes, right? My output is the count of things that happened, right? I had 5 hospitals who participated in my financial project, right? The outcome is the thing that happened, or the thing that changed, I should say, the thing that changed from it. So the boxes on the left are the projects that we usually do, right? Conducting a financial intervention, doing financial improvement TA. The outcome here would be either the improvement, the decrease, whatever it is that you're measuring is the change. So please come back and reference this when you're looking at examples and outcomes that you're trying to collect. Next slide. Okay, everybody's favorite document, budget justification. So any changes you've made to your budget within less than 25% of your budget can be talked about here and tell us everything going on. Anything that was over 25%, I hope you asked for a prior approval to do that. And if you didn't, you'll need to wait and do that after the NCC. We will need a detail breakdown for all of the categories that are about to come that we're going to walk through. And I know everyone has a question on their minds about what is our funding level for this year. For this submission for your NCC, please base your budget on last year's FY25 flex levels. I know everyone's looking and knows that we had an increase in the flex line. We are still figuring out the exact dollar amounts that go into everything that gets funded out of flex. It's at least 8 different programs. So stay tuned. There will be an increase. I don't know how much it will be. And once we know that, we as your POs will come back and tell you, and we can figure out what to do with the budget. We're just figuring out what that dollar amount looks like for everyone. So under personnel, we need to know each employee that is supported by funds from Flex. And as a reminder, we need at least 1 FTE that should be allocated to the Flex program, okay? This would also apply to subawards and subcontracts, but when we're talking about that personnel, if it's a contractor, that goes under the contract section. Next slide. Okay, travel. Please make sure to itemize all of your travel, and that means airfare, hotel, per diem, mileage, car rental, everything. And please make sure to include travel to the Flex Reverse site visit, 1 other regional or national meeting each year. Any new staff that are responsible for working on the Flex program need to attend a workshop within 1 year of their start date. So if you have someone new in your office, please add that as well. Equipment is not an allowable cost for the Flex program. Supplies, list out anything and break down the costs for what supplies you need to implement your projects. Next slide. Your contracts. This is one of the areas, I will say, in your budget that has the most questions, the most revisions where we are needed. All contractual entries need to have a detailed breakdown of how much each deliverable will cost. So I have an example right here where this tells us we need 2 trainings that are going to happen at that are open to QI directors, right? So here's your cost estimate that says $3,000 facility fee, $7,500 consultant charges, $2,000 for mileage, and for 2 meetings, right? And that's going to total up to $22,000. Okay. What we cannot have is if you send us a budget that says, I have $100,000 allocated to a contractor to do financial improvement work. That we need more information from. The GMSs need to know what's going to happen. And I know the most common question that we get is, well, I have to send all this out for RFP, right? These have to be competitive bids. So what do I put there? I don't know what the costs are going to be. That's okay. You can tell us what you expect, right? And if that has to change, that's not a problem. There can be 3 meetings instead of 2. You can have 5 hospitals that participate instead of 6. It's not a problem. We just have to know what you expect to get out of this. Next slide. Okay, if there's anything that doesn't fit into these categories, please put that there. Indirect costs need to be no more than 15% of direct costs. That limit comes to approximately 13.04 of the total program award. Okay, next slide. Budget restrictions. Any recipients and subaward recipients, you cannot use flex funds for direct patient care. That also includes equipment and supplies, purchasing ambulances, vehicles, or communications equipment in general, and that does include software over $10,000. You cannot conduct community health needs assessments. You can't purchase or improve real property or any purpose which is inconsistent with the language of the NOFO. Next slide. Okay, so if anybody needs it, we have a budget template that is posted up on the Flex website. I took this screen grab a couple years ago. It gets updated the years don't necessarily matter. We can update the dates in there, or you can, but this is a great sample budget that you can go in and fill in your information. So we will send all these links out along with the slides so you can access this off of the task website. Next slide. Okay, attachments 4 and 5 are the easiest ones. Attachment 4, position descriptions for all new or revised positions that are working on the program. If you have no staffing changes, please make a note. You need to include that attachment that says no changes. Please don't list it blank. And again, if there is a new project director, then we need to have a prior approval process going through EHB. Next slide. Okay, biographical sketches. This would be bio sketches, CVs, resumes for any new staff hired since March 2024 when you did your application. Same as the previous slide. If you have no staffing changes to report, please upload a document that says no changes. Next slide. Okay, attachments 6, 7, and 8 are only for the states that have EMS supplement report or EMS supplements, right? So your first one is your progress report. All of this information is the same as last year for those folks who did this. So give us an update on what your progress is, how you've made your future work that you're trying to do for next year, progress, changes, challenges you faced, anything that you maybe haven't completed that has a delay, if you've had any staffing changes, and what your plans are to mitigate those changes. Next slide. Your budget justification, same as on your regular flex. You need to tell us what the overview of your proposed spending and then detail the use of federal funds for each object class category. Travel and contractual costs need to be itemized. Same information for the previous one, and we will just, again, send these slides out for you, and you can ask Talia with any questions. Next slide. Work plan for the EMS supplement folks. We need you to update your work plan template. That is posted up on the task website, but you'll update the same, your current year's work, tell us what you've done and what your plan is for next year. Again, Talia will answer any of those questions you have on what you need to fill out there. Next slide. Okay, I just put in a little reporting requirement here to let you know what's coming up in the year. So your FFR due date has not changed. That is still November 29th. It's 90 days after the end of your budget period. The end of year report in your new data collection platform, the new DCP system, will also be due November 29th. We're streamlining all of our programs across Flex, Ship, and SOAR to make sure that all of the annual reports are due 90 days after. It didn't really make much sense to me before that we had the PIMS report in EHB due 60 days after the program ended, and then have an end of year report due 30 days later. So we've combined them into one submission, and they will be due 90 days later. So then same as usual, carryover request is due December 29th, and we will be having this same webinar next year in March for a due date in May of your next year's competing continuation, or non-competing continuation, sorry. Next slide. Okay, very, very, very quick MBQuip updates here, just because we are in the middle of this new implementation timeline. Next slide. Okay, so that blue arrow that's right there. For anyone who has seen this before, that is where we are right now. If you have not seen this, if you are brand new to Flex, we have been working for the past few years to update our MBQuip program, right? This is kind of our implementation timeline going all the way back to September of 2023. But I'm putting this in here just to let everyone know 2025, the current year that we are in, is where you all are starting to track those non-reporting hospitals who are not reporting your MBQIP measures. Okay. And then come in November of 2026, that is when you're going to submit that spreadsheet back to us for the first time, the tracking spreadsheet. And I know it's coming late. We were supposed to have this out a whole long time ago, but we had changes to the MBQIP measures and we had to update the spreadsheet. So that is coming out very soon. This is going to be a really great way for us to have actual information from you all as to what the challenges are when your hospitals can't report any of the quality measures, right? Or some of the quality measures. We have a lot of anecdotal evidence, but FORP gets asked all the time questions from CMS that says, what if we propose this measure? And what about that one? And we can use this to share back with CMS and let them know what the struggles might be. So in November, you will submit that tracking spreadsheet back to FORP for the first time. Stay tuned. All that information will be coming and we will have lots of resources and things to talk about soon. Next slide. Okay, I've got a few emails here just in case anybody has any questions and they want to reach out. Task, you can reach out at task@ruralcenter.org. The FMT email is really for Maddie in Minnesota, but she can point you to the right folks if you need it. fmtdata@umn.edu. Arkita is arkita@telegen.com. And go ahead and reach out. They can help out with any questions you have for your NCCs, answer questions, review work plans, things like that. Just let anybody know that you have or that you may need some help. Next slide. Okay, this is just a quick overview of which states belong to who. So this is color-coded as to who your project officer is if you do not know. And if you have quality questions on MBQIP, you can reach out to Lorraine with all of our contact information. And I think that is the last slide. And I might have done this whole thing in a half an hour, and I'm really impressed. Next slide. I did. Wonderful.